Health Minister Dr Aaron Motsoaledi announced that 5,300 jobs will be filled in the health sector. He was in the Eastern Cape yesterday to announce a turnaround strategy for the health department in the province, which has been left in shambles. Minister Aaron Motsoaledi joins us now from the Pretoria studios. Minister, great to have you on the show. Welcome to Morning Live.
Good morning, Leanne, and good morning to the viewers out there.
So, Minister, your focus yesterday on the Eastern Cape Health Department was really to turn around the mental health facilities. You've appointed Professor Dan Mkhize as the new administrator of mental health services in the Eastern Cape. Talk to us a little bit more about this appointment.
Yes, it's not to turn around the mental health facilities only, Leanne. Is the whole mental health directorate. If you remember, there was a problem at Tower Hospital, which is a mental health facility in the Eastern Cape. But when the Ombuds released a report on recommendations, he recommended that the whole mental health directorate in the Eastern Cape be put under administration. And that's what Professor Dan Mkhize is going to be doing, to review all the policies about mental health in the whole province and even in communities, not only in the mental health facilities.
Yeah. So, however, in September, the Eastern Cape Department of Health issued a 120 million rand tender to outsource chronic mental health care in the province. What's actually become of this?
Well, I didn't check that. Everything that is happening in mental health is going to be reviewed by Professor Mkhize. That's why yesterday I took him to the Eastern Cape to introduce him to the department and other stakeholders. And as I left, he was developing a program and timetable to meet with them. One of the things he's going to do, as I said, is to develop policy. And according to the recommendation of the Ombud, can only do so through broad consultation with communities, academics, stakeholders, NGOs. And it is through that process that some of the problems that might have happened will actually come out.
So this is basically after the Health Ombudsman recommended that the health department be placed under administration. So in other words, what's happening now is Professor Dan Mkhize is the administrator and he's going to be looking into the entire department in the Eastern Cape.
No, not entire department, but the mental health directorate.
Yes, the entire mental health.
In the Eastern Cape department.
Okay.
Yes, everything about mental health in the department.
In the department. This was yes, ordered by the Ombudsman in August. Has he been working on it for a while, or is this now just the announcement that he'll be looking into it?
Oh, we've been working on it for a while. Professor Dan Mkhize was actually appointed a while ago. Yesterday, it was just introducing him to people who he's going to work with. He has already been to the Eastern Cape, by the way, but I was introducing him officially yesterday.
Okay, all right. Also, we have a look at the Tower Mental Hospital. Now, that's one of those hospitals that, unfortunately, has been shrouded by a lot of controversy and with patient abuse being claimed by many in the Eastern Cape. But the said conditions at the hospital are about the systematic failure of the health department. Has the department followed up with the Eastern Cape department on this facility?
Leanne, remember that the Ombud never made those findings. Those were allegations. And he found that there were no human rights abuses of patients at Tower Hospital. He found that it was a false report. In fact, you'll remember that the person who lodged that report has actually been suspended. And the Ombud found him guilty of what he calls scientific fraud for having lied. But having said so, yes, he made recommendation that there were systemic failures in the mental health directorate in the whole Department of Health, not only for Tower Hospital. And that's why he said they must be placed under administration. But there was no finding of human rights abuses at Tower Hospital. Remember, some people were actually dipping it, life is demanding too, and the Ombud had very strong words about that. He said it's not true, there's nothing like that.
Okay. Well, we're going to be actually talking to the Premier of the Eastern Cape tomorrow, so we can follow up on a lot of these allegations within the province and what's been happening in the health sector specifically. So that's something that our viewers can look forward to. I want to come to Gauteng. Before we touch on the good news story that actually came out of the Health Department yesterday, we saw in Gauteng a group of people marching to Premier David Makhura's office demanding compensation from the government, the Gauteng government, following the Life Esidimeni tragedy. They also marched to Luthuli House, in fact. The Gauteng government says it has settled all 134 claims. However, there were 144 families affected, and there are new claimants as well, basically now adding 200 to the total that say that they should have been paid by yesterday. What do you have to say about this?
Well, I think, Leanne, it will be fair to direct that question to Gauteng Department, because they are the ones who are paying. I think it's a technical question as to who has been paid, who has not been paid, who has been verified. And I think Gauteng Department of Health or the Premier's office will be in a better position to give details about that.
Yeah, certainly. I know that the response from Thabo Musebe, who is from the Gauteng government, basically saying that no one stipulated that the verification process was complete. So this hasn't even been completed. Are you saying this is under the jurisdiction of the Gauteng government and they need to complete this process?
Yes. Gauteng government is the one which is paying. Remember, the UMBAT has ruled the categories of people who have to be paid, and they have to be verified, and there have to be processes of how that payment is effected. Okay. And that's why I'm saying those are technical issues that they could answer very well.
All right. Minister, let's talk to the issue of 5,300 positions that you want filled in the medical sector. This is really good news because there is definitely a lack of medical professionals throughout South Africa. You hear these stories on a daily basis. Now, what you have said is that local South African medical professionals will be given first preference. Talk to us about these, and I know that the job fillings will take place from January next year.
Yes. We, as you know, one of the biggest problems the healthcare system is the shortage of staff, which has become worse over the past 3 years because of budgetary cuts which were necessitated by the economic climate in which we are. That's why when the president got a clear explanation and a deep understanding of it, said we must start solving it via a stimulus. After he announced the stimulus to kickstart the economy, he also said there must be stimulus in health to deal specifically with 3 issues. That is human resources, the health workforce, learning, bed and linen. So we have announced what we are going to do about human resource, but provinces also, in addition, because they are the ones who are feeling the pinch, because they are the employers of the health workers, mobilized resources within their own provinces. And on Thursday and Friday last week, we met in the National Health Council, which is a statutory body consisting of the province, the National Department of Health, the provinces, the South African Military Health Council, and services, and SALGA. We sat and looked into this issue over a period of 2 days, and we came up with a figure of 5,300 health workers that must be employed in the clinical and support services.
Now, Gauteng, Western Cape, Eastern Cape, these are the provinces that came out with the most lacking when it comes to vacancies and the need of these medical professionals we're talking to. When are you hoping that these vacancies will all be filled by? I mentioned January 2019. Obviously, there's a process that needs to carry on from there. So when are we hoping to fill them?
January means that's the time at which the man will start being applicable. Which means from the 1st of January, anyone who is ready, who has gone through whatever processes of appointment, can start work. So it's just the starting time. Obviously, some will be hired maybe towards the end of January or February, but the day of the 1st of January is the day on which all the resources which are going to pay for this workforce will kickstart and will become ready.
Yeah. When we talk about the vacancies, what are we talking to when we say medical specialists? Are there certain, is it only for doctors, medical professionals, or are you filling vacancies for a lot more positions than just medical professionals?
No, I said it's clinical staff and support staff, meaning it's from medical specialists to registrars, which are medical specialists in training, to medical officers, which are doctors who have already completed their community service, to professional nurses, to specialist nurses, to enrolled nurses, enrolled nursing assistants, pharmacists, pharmacy assistants, radiographers, physiotherapists, occupational therapists, general workers, mortuary attendants. It's all the works, everything that is needed to make the healthcare system to run smoothly.
Yeah, I know that you mentioned yesterday that a lot of look, there was an amount given by our president. I just want to have a look at that proposed amount. Treasury allocating 350 million for the project of filling 2,200 posts. You of course mentioned now that it's going to be much more than that, and saying that the additional funds will come from the respective provinces. Can you talk to the amount of money that's going to be spent on these positions?
Just come again. Can we talk?
Can we talk funds? How much is going to be spent on filling these positions? The Treasury had allocated 350
the 5,300.
Indeed, for
the 5,300.
Yeah.
Yes, it will cost about 2 billion rand.
2 billion rand. And these are also going to be funded from the different provinces, correct?
Well, look, we issued a statement on Monday. If you read that statement, it says from the stimulus package as well as from other sources which have been mobilized. So over the past 2 days we've been sitting, we're looking for sources all over the country. But basically the money comes from the same fiscus. There's only one fiscus in the country, but with monies in different areas of the fiscus. And we're mobilizing those monies to put them centrally and make sure that we improve the staffing with the healthcare system. Because as I said, it is one biggest problem that the healthcare system has been experiencing.
Yeah. Another big problem, however, is low salaries that these doctors and medical professionals actually get paid. Will we be seeing them remunerated at a decent level for the work that they do?
Well, I'm sure you are aware that I'm not the one who determines remuneration. Leanne, remuneration is determined by the Ministry of Public Service and Administration in the Central Bargaining Chamber with all the unions. They determine remuneration for all the public servants. And the Minister of Health, like all other ministers, do not sit and determine remuneration for various public servants within their department. It's done centrally, headed by that ministry.
All right, fair enough, but I imagine you would ask for decent remuneration for the staff. I know that it's not your responsibility, but I would imagine it's something that you would speak to your counterpart and say, we need to remunerate these professionals to the best of their ability. And just finally, I'll need to get off that. I understand your point on that, but just I want to ask you about rural areas as well. There are many vacancies for medical facilities and professionals in rural areas. Is this also going to be a part of the plan?
Well, the vacancies don't exist only in rural areas. It exists everywhere. I mean, if you look at the hospitals in Gauteng, we're also dealing with a pattern of disease and migration, where people migrate from rural areas, even from the neighboring countries, Leanne, to come into Gauteng. So it's very urban, but the hospitals are very full. For instance, we have just reported that all the neonatal units in Gauteng are 132% full, which means the staff that is there will never cope. If it was adequate staff in the past, it's no longer adequate because the number of patients have increased exponentially. So the shortage in the country is experiencing both rural and urban settings, and we are making the post available for all those settings.
Good. It's good to hear, because when you hear the response from the health workers and the National Education, Health and Allied Workers Union, and I quote what they have to say: our members and workers are subjected to perform duties that are meant for 5 other people. A nurse is forced to be a porter, an administrator, and a caregiver at the same time. The end result is that the staff are overworked and the minimization of the quality of service delivery. And that is at the heart of all of this. Are we hoping through all of these appointments that we can eliminate these problems that the workers in the healthcare sector face?
Yes, it's the start of eliminating them, Leanne, and that statement from Nehau is correct. Early this year, I think it's in May, I went to Tembisa Hospital with President Ramaphosa, and we were taken to the neonatal unit, which is designed for 40 newborn babies. But on the day we arrived, there were 70, and the nurses told us that they can go up to 90. But there were only 6 nurses in that unit. That's why there is an ejection of more than 245 nurses in the Gauteng Department of Health to try and relieve that. It was more of overcrowding that has made the staff shortages, and that's what Nehau is talking about, and that's why also we are including general staff in this 5,300, because the healthcare system is not only run by professional clinical staff. It also needs porters, as it has been said. It needs general workers, it needs artisans, it needs many other information officers, it needs administrative clerks. And if you look at the basket of posts province by province, we have tried to include all those.
All right. Minister, we thank you very, very much for your time. Thanks so much for talking to us here on the program. That's our Health Minister, Dr Aaron Motsoaledi, talking to us about these vacancies that the Health Department across the country face, and they are going to be filled, and South Africans are going to be given preference to those jobs.